Welcome to Making Change Radio. I'm your host, Catherine Reed, and tonight we're talking about the 2020 Census. Joining me are three guests who represent organizations that are working collaboratively here in the Fairfax County, Northern Virginia region to make certain that every person is counted in this very important 10-year census. Here in the first segment is Caroline Rankin, Community Impact Analyst with Neighborhood and Community Services for Fairfax County Government. Thank you so much for joining us, Caroline.
Thank you, Catherine. Great to be here.
So, Caroline, explain a little bit about, what you're in your role in the Fairfax County Government. You are working with this collaborative. There's sort of an enormous collaborative effort of nonprofits and agencies here in the Northern Virginia area working to make sure every single person is counted. So perhaps give us a little background on why this enormous push by so many different organizations to make certain every person is counted.
Sure. So as you may know, the United States takes a census of all of its residents every 10 years. And a census is meant to be a complete and accurate count of everybody living here. And what that does is it allows federal, state, and local governments to portion out funding for all kinds of important services, human services, safety net services. It also allows us to appropriately portion out the representatives that are representing us in both federal, in our Congress, and in our state legislatures.
and I think initially when the Constitution was written, because this census goes back to 17, I don't remember which year, but it goes all the way back to the beginning of the country, because really back then it wasn't about apportioning federal dollars so much as it was drawing the lines for representation politically. So we have done this every 10 years since our government was founded. And what's interesting about that is that it has produced a lot of historical data, even though census information isn't released until 72 years, I think, after it's collected. A lot of the history of this country is because we do this very important census, a snapshot of who's living where, who makes up a household. And so for historical reasons and for political reasons, the census is very important. But in this day and age, in the 21st century, and why your organization, this agency in Fairfax County and nonprofits are interested, is because there are a lot of federal dollars apportioned for really important programs on the state and county level.
Yeah, absolutely. So according to some calculations, in the Northern Virginia region, for every resident who does not respond to the census, local governments could lose $12,000 in potential funding over the course of a decade. So that's $1,200 per person per year. And if you start to, extrapolate that out across entire households or neighborhoods where we know it's hard to count our residents, that's a lot of money that we could really be using for infrastructure and schools and emergency response.
That is so true. And so as we go forward and look at what some of the hurdles are to trying to get people, so everybody got something in the mail. Every household received a notification that they needed to respond to this census. Why don't you walk us through a little bit what the process should ideally look like from the moment somebody gets a notice in the mail?
Oh, certainly. So by now, residents and households have probably received several notices in their mailboxes if they haven't already filled it out. And what they're finding is that for the first time ever, it's possible to complete the census online, virtually, which is important, especially right now as we're working with social distancing mandates. And so people can go to my2020census.gov to fill it out online. They can also call a telephone number. For English, it's 844-330-2020. Or they can simply fill out the census form that they receive in the mail and mail it right back to the Census Bureau, and they will have completed their census and done a great service and not have to come into contact with anybody new.
Right, so that you can do it online, you can do it by phone. Is there a mail-in option this year?
There is, yeah. So by now, if people have not filled out their census, they should have received a paper copy in the mail by now, and it's no postage required. The government's going to take care of the postage, so you can just fill it out. It's just filling in dates of birth and how many people live in the household and things like that, and fill it out and just mail it right back.
So what are some of the hurdles to getting people to actually complete the census? Right now, and there was a snapshot, I guess figures were put out today about where Virginia is compared to the nation, and we're slightly ahead of the national response, which I think is 48%. And in Fairfax County, we're even above the average for Virginia. It's 60-something%. So,
yeah.
So what is preventing people from just jumping on and answering the census?
So, Fairfax County as a whole, we are, we're at 63.6% today. So because the census is available online, the Census Bureau is doing a real-time count of response rates, which is, kind of fun. We have little competitions going between the local jurisdictions to see who can get the highest and the fastest and things like that. But it's interesting because, as a whole, Fairfax County is above the national average. But you can also look at Fairfax County and its neighborhoods or census tracts. And when you do that, when you drill down, you see that some of the census tracts are down at near around 40%, which is below the national average. And those are what we call our hard-to-count populations. Those are going to be people who might not have access to Internet. Believe it or not, there are some places in Fairfax County where like 20% of households don't have regular access to Wi-Fi, and so they're depending on their cell phone plans to, answer the census, which can be quite expensive. So Internet access, language access can be an issue. Although the census has taken care to translate their website into, I think, 59 different languages. There is also a visual service for visually impaired and service for hearing impaired as well. There are telephone numbers that people can call where they can call and speak directly to someone who speaks their native language. That's, I think, again, the 59 different languages. So language access can be an issue. I think the biggest issue, though, is distrust of government and just an unwillingness to trust that the information is going to be safe, that it's not going to be misused. And so people are fearful for different reasons, and I know some of the other guests are going to get into this more, but some people are afraid of immigration, and I want to remind everybody that this is a count of all residents, of just people living here, not citizens. So citizenship isn't even asked as a question.
And but that did come up earlier. There was a very public debate over whether there should be a citizenship question. So for those of you who are just joining us, this is Making Change Radio. I'm your host, Catherine Reed, and tonight we're talking about the 2020 census, which is well underway. And joining me in this segment is Caroline Rankin, who is the Community Impact Analyst with Neighborhood and Community Services for Fairfax County Government. So let's talk a little bit about the fact that even though there isn't a censusship question, the very fact that it was It was a very divisive sort of debate that took place earlier in the year. The Supreme Court ultimately struck down the question. That has not necessarily helped the cause for getting people already distrustful to believe that their citizenship is not going to be an issue. Is that correct?
Absolutely. Yeah, it just sort of planted the seed of doubt. And even though in Fairfax County, our police officers our police force has, pledged that, they're not going to work with ICE with regard to the census and try to report people. But people are just fearful in general about immigration and status and that sort of thing. People are also afraid of perhaps their landlords finding out that more people are living in a household than is technically correct according to a lease agreement. And again, census information is confidential. Census personnel are not going to divulge any. They don't really care really how many people are living in a house. They're not going to tell a landlord or anything like that. And actually, they would be fined, I think, about $5,000 and get, I think, 5 years in jail. It's some pretty stiff penalties for census workers if they were to share that sort of information. And I think, the fact that all the census workers have to take a pledge and sign confidentiality agreements, and they're held to this really high standard of not sharing information, I think that speaks to how valuable that information is and how seriously the Census Bureau takes the security of that information.
And I think that's an important thing to drive home, is that we all need to be encouraging people to answer the census. The coronavirus and this pandemic has sort of overshadowed the effort to count every single person. It's also complicated it for sure. But the other thing is that it's supposed to be a snapshot of who was living in your home on April 1st. Well, by April 1st, schools were closed. Businesses had closed. People were self-isolating. People were self-quarantining. So people's households might have looked slightly different on April 1st. And how much do you think that might be confusing an already unfamiliar process to a lot of people?
Yeah, certainly, because normally the message we give to, say, college students and parents of college students is count that child, count that young person where they're going to college. So if somebody, if their family is from here but the child is going to school in, say, Massachusetts or Ohio or something like that, then that school or that university would be working with the census to make sure that all those college students were counted. Overall, we think it probably evens out all those college students either staying where they are or returning home. But it certainly took a lot of the wind out of the sails that a lot of efforts were putting into getting the word out that the census is here and it's important to count. And I mean, it's sort of ironic that, with what's happening with the coronavirus public health crisis, it really amplifies the partnerships between county government and nonprofits and faith communities, and shows how we really do work hand in hand. And part of that has to do with having accurate information to know where to put those efforts, where the vulnerable populations are living that need more support and need a little bit more services.
Exactly. And so I think people need to understand we do this once every 10 years. So if we undercount who's living in the county, who's living in Northern Virginia, who's living in Virginia, that impacts us for the next 10 years. So, as I think you pointed out at the beginning of the segment, there's a dollar value attached to that data into properly accounting for every person who's actually living here, taking advantage of things like public transportation or the public school system or driving on our roads or being housed in whatever type of housing they're in. This is really important information, and so people need to help the effort by talking about the census. I'm surprised that I got a text message from a nonprofit that's Virginia-based asking me to respond if I'd filled out the census. And they're like, respond yes or no, and I responded with a yes, and they're like, have you completed it? And I said done. And I just think it was very interesting that so many organizations are using really interesting methods of trying to reach out to the people that they have contact information for. So that's just one example of a nonprofit saying we're going to help by asking people over text messaging, have you done it? Tell us if you've done it, and sending a link if they haven't done it. Like, if you haven't done it, here's the link, just click here and complete it. So I think we all need to be somewhat well-versed in what the questions and the challenges are, because we're surrounded by people at a distance, 6 feet apart at this time, but we're surrounded by people who may not have filled it out, or who may not think it's a priority, or who, may think the coronavirus is just more important than taking the 10 to 20 minutes to go online or to get on the telephone and answer the census. So, what can we do, Caroline? What can people listening to the show do to help spread the word and be knowledgeable enough to have a conversation with people, and to just simply ask if you responded to the census?
Absolutely. Yes, I think just simply encouraging people, just bringing it up, planting the seed in people's minds can be really helpful. Making sure that we don't forget our little ones, because, there is a dollar amount, and that's quite powerful, but there's also planning that happens. And so children under 5 are actually the biggest group of residents that are undercounted. And I was not watching PBS, but I saw a commercial with the Count from Sesame Street, encouraging kids to encourage their families to complete the census. And I thought it was brilliant because, first of all, the Count is, he was my favorite character from Sesame Street. But making sure that we know where our little ones are, so we know where to plan where do we need to build the next elementary school to make sure kids can be included in having a nice close elementary school.
And that is a perfect segue, Caroline, because our next guest, Ondrea, is going to be talking specifically about that, about the undercounted populations, particularly among children who aren't in school and children who are in school. So I want to thank you for being on the show. You've been invaluable in this, and I know that you're going to continue to work really hard in your position with the Neighborhood and Community Services to get the word out, to make sure that everybody in Fairfax County is filling out the census. So thank you for being with us tonight.
Radio Fairfax, the go-to station for a truly unique and rewarding listening experience. Made by producers who want to share their love of music, talk, or ideas with you. Free of commercial corporate radio control. Radio Fairfax, your voice, your station.
You may have heard people talking about the April 1st United States Census and wonder what it's all about. The census is a count of everyone currently living in the country. It happens once every decade, and it's at the heart of how Fairfax County serves our residents. The census helps determine how much funding Fairfax County receives from the $675 billion that the federal government allocates each year to improve transportation, provide education, healthcare, affordable housing, and prepare for emergencies. For each resident who does not respond to the census, Fairfax County could lose $12,000 in potential funding over the next 10 years. Imagine if one family of 4 doesn't reply, or 10 families of 4. The amount of lost resources for our community could really add up. The census helps Fairfax County decide where resources go based on where people live, including schools, roads, firehouses, police stations, and clinics. It establishes how many representatives we send to Richmond and Washington, D.C. to advocate for our community. You can have a big impact by completing the 2020 census. The U.S. Census Bureau will mail every household an invitation in March to complete a simple questionnaire about who lives at your address on April 1st. You can respond online, by phone, or by mail. The form will ask ask for names, age, sex, race, and the relation of everyone living in your household. To ensure a complete and accurate count, census takers visit residents who do not respond. Federal law keeps those responses safe, secure, and confidential. Your name and address cannot be shared with law enforcement, immigration enforcement, or any other government agency under any circumstance. The information is only used to create accurate statistics about the nation's people, places, and economy to help serve our community. In Fairfax County, we believe everyone counts, no matter how young, how old, or your immigration status. If you live here, we want you to be counted. Visit fairfaxcounty.gov/topics/census to learn more, and remember, in Fairfax County, everyone counts.
Welcome back to Making Change Radio. I'm your host, Catherine Reed, and tonight we're talking about the 2020 census. In this segment, I'm joined by Ondrea McIntyre-Hall. She is the Director of Health Access and Nutrition Services for the Northern Virginia Family Service, also known as NVFS. Thank you so much for being with us tonight, Ondrea.
Thank you, Catherine. It's my pleasure to be here.
So in the last segment, we were talking with Caroline about counting children birth to age 5, many of whom are not in school, but also school-aged children, and the difficulties and hurdles in counting this particular population, but also why it's so critical to get an accurate count of these children. Can you give us some background on what that critical need is and what we're doing to try to meet it?
Okay, absolutely. Let me start with a little history. Back in 2010, the birth to 5 population was undercounted nationally by 10%. In the state of Virginia, we ranked 8th in the number of children undercounted at around 29,000 kids from birth to 5 not being counted. That value that the state lost was around $350 million. At the same time, in Fairfax County, about 6.7% of the population of birth to 5 were not counted. And so when you think about capturing that birth to 5, it's really important to know that population because you're going to spend the next 10 years outlining the kind of services that these children need in order to be competitive later on in the workforce, as well as their opportunities to thrive. It also helps us understand, where the inequities are in our community, where resources need to be allocated. Proper preschool and quality preschool programs that need to be in place, particularly when Catherine was talking in her segment, she talked about low response communities. Those are some of the very communities where we really need to count because we need to be able to have services in those communities to be able to lift those families. And so it becomes really critical to get those children birth to 5 counted. The other thing, it helps us understand, where we get federal dollars to also have programs like Head Start and Early Head Start. And those programs are critical to two-generation impacts. So oftentimes they work with families who are living in poverty, and they not only help it not only helps the children rise, but it also helps the parents rise. And then it creates this model that generation after generation, because there's a certain level of career and educational attainment, that it sets up a model of success for the children and families who come through that program. So that's why it's really critical, because we really want to understand where we're allocating our resources in the state, how we invest those dollars in our early childhood programs. And the challenge around the account is there are a lot of times that families just don't, there's a misperception about who's actually supposed to be counted in a household. So oftentimes the parents, they found nationally, they don't even think to add the kids to their census form.
Wow. That makes it hard to plan for how many elementary schools you need to build. And I think it's interesting, too, given your role at NVFS, too, in supporting families, is there's been more of a national dialogue about infant and maternal health and infant and maternal mortality rates. So when you talk about asking for birth dates on the census, why they need to know how old people are, we need to know how old the babies and children are, because if they stay in our county, they're going to need services over the next 10 years that might go from needing quality, affordable daycare to needing, a variety of programs in the public school system. But you also have women of childbearing years, and you need to know how many there are, because clearly that impacts our healthcare system too. We recently got Medicaid expansion in Virginia, finally, after so many years. But the census also helps us to figure out what age groups people are in who are in areas that are now taking advantage of Medicaid expansion for their primary health care. So I don't necessarily think the average person spends a lot of time sitting around thinking about why all of this is so important for us to have healthy communities, not just in Northern Virginia, healthy communities everywhere. And there are certainly in our community high need, families with high needs, neighborhoods who have high needs for additional services. And I know that NVFS has been instrumental for decades in providing a lot of those services to families in these communities. So, how do we help families to understand that there's a reason that they're asking for the birth dates, that there's a reason that we need to count, infants. My cousin just gave birth on April 5th, so her baby does not count, because this is about April 1st. And that's the other thing about the confusion of when you count them, because this is supposed to be a snapshot.
Correct.
So how do we talk about that?
Well, I'll tell you, Northern Virginia Family Service, we have been planning for a long time, because you're right, there are a lot of critical services that we offer to residents throughout the region, not just Fairfax County, but throughout the region. We actually have Head Start and Early Head Start, our Healthy Families, we have Workforce Development, Mental Health Services, a Hunger Resource Center. There are so many things that we do that we have an opportunity to engage very directly with the population that we serve. We serve upwards of 40,000 people. And it's funny, I actually kind of looked at the dollar figure, and, if the estimation is $12,000, per person counted over 10 years, that's about $480 million based on just 40,000, serving 40,000 people. So the census becomes critical to nonprofits because it helps block grants come into the community. A lot of the supportive services that high-need families need to have access to, like free and reduced lunch and SNAP and TANF and Medicaid and the Kids Health Program. Also the housing grants, housing assistance. Making sure that you include those children as well as the adults in your home become critical to understanding what the capacity is of the individuals in the community, how densely people are populated, where does that next, as Caroline said, it's important to have a school within your community. That census tract information helps us understand where does that next school need to be. I tend to look at a lot of things through a social determinants of health lens, and so, all of this information really kind of helps inform how I see and advocate to ensure that people participate in the census. But as I was saying, NVFS early on adopted a strategy how to get the word out because, to Carolyn's point, it's really important to have a trusted entity that you can use to deliver messages. And so we spent a lot of time training our staff. We rolled out weekly messages about different components of the census so that our staff really felt comfortable helping to advocate as they engaged with the clients, even through COVID-19, about getting that census completed because it's so important to the access of the services that we continue to provide over the years.
But those trusted relationships, you're absolutely right. They may not trust the government, but they trust an organization who has continued to support them in good faith. For those of you who are just joining us, this is Making Change Radio here on Radio Fairfax. I'm your host, Catherine Reed, and we're talking about the 2020 census, why it's important, and how you can get involved in making sure that every person is counted. Joining me in this segment is Ondrea McIntyre-Hall, who is the Director of Health Access and Nutrition Services for Northern Virginia Family Service, NVFS. So one of the things that you had mentioned was about housing, and we talked with Caroline about the fact that many people are afraid to disclose how many people are in their household for fear that such information will be given to their landlord. But again, because affordable housing in general is so critical in this area of Virginia that it's so important to know how many people are living in any one address, and not to punish people, but to better support families who have inadequate housing. We know that people do not have adequate housing, that there's not enough affordable housing, that in some neighborhoods and communities that there is overcrowding. And back to your social determinants of health, that does not make for a healthy family or a healthy community. So getting over this hurdle of helping people to understand that knowing how many people are at an address will make such a difference, such an impact on planning, zoning, building, development projects. How do we get that message across? I fall back to there are those trusted messages. As part of the Complete Count Committee for Fairfax, we talked a lot about this, about how to dispel this myth around getting folks to be able to fill out the census regardless of the number of people that are living in the household. Look, the fact is you're right, housing affordability, the number of affordable units that are in Fairfax County and the region, all of those things, people are doing what they have to do to survive, to keep their head above water. I am not mad at that. And sometimes it's a matter of, braiding your resources with another family in order to be able to, have a roof over your head and support each other. So the fact is, like Carolyn said, the census really doesn't care. We just, if it's a home that has 2 bedrooms and you got 4 families living there because people are trying to survive, we just want to know that there's 12 people. I mean, we don't care if you're related. The census. The census doesn't care if you're related or if you're not related. They send that card to the house, and the expectation, or that that home address, and the expectation is everybody gets to add their information for that address, because they are actually counting addresses, home addresses. They're not counting, is this Mr. Smith's house? They don't really care if it's Mr. Smith's house. They want to know if, 8252 Smith Street, how many people are living in that house. They don't even care who owns the house. They just want to know how many people are in that residence. And that's the message that we're really trying to convey with all of the messaging, done through the social media campaign with a number of the jurisdictions and regionally. That, and to Carolyn's point as well, the census police are not coming. Nobody's going to say this house is, zoned for this many people, and why do you have this many people living here?
the census doesn't care about that.
But conversely, Fairfax County and Arlington and Alexandria do care, because that data those data points provide a map for what the county and the cities need to do to appropriately accommodate the number of people living here. It's so important for people to understand that overcrowding can only be alleviated if you know that there's overcrowding. We can't solve a problem if the data doesn't show us there's a problem. Then there's no problem to solve. So
correct.
I don't know how we get past these barriers in people's heads about feeling threatened.
Yes, and my clarification in terms of don't care, I meant from the standpoint we care about the data, but there's not a judgment being made from the Census Bureau if you have too many people living in a home. That's I want to make sure that I clarified that part. So yes, the jurisdictions actually do care, because if you have a particular census tract and there's not enough housing, then that informs where development needs to happen, affordable dwelling units, all of those things. How many vouchers, housing choice vouchers maybe come into a community? How many block grants get awarded to a particular jurisdiction for housing? How many programs are available for rental assistance? So there are a number of programs that get impacted by knowing exactly who is living in a community, granular down to the census tract. You're absolutely right.
And I think we should make a point of just mentioning the fact that foster children, group homes, other kinds of group settings have their own way of being counted. So we're not talking in this show about these complicated group housing settings. We're just talking about your regular residential street address.
Correct.
Right. So when people are thinking to themselves, yes, but for instance, there's a group home in the neighborhood where I live. I know for a fact that the census and the people managing the census already know that, and they will be counted. And there's a foster care system. So there are foster children living in homes with families, and there's a way of counting those people. As you mentioned before, college students. There's a protocol for how you count students who are living away at school. So we're just talking about your average house on a street where whoever's living there, whether they're related, not related, more than one family, whatever the context is, what the government needs is a snapshot of how many people are living there. And again, their ages. Are there children living there? And how many? And for nonprofits like yours, it becomes critical because you are providing the services to a lot of these families that, the government, the Fairfax County government relies on NVFS to provide.
Oh, absolutely. And so it remains essential then that the count be accurate so that the federal dollars that that become available to the state actually filter into the communities based on the amount of need for each of the jurisdictions. So you're absolutely correct. And, it's interesting because we did our census as well as a household. And I will tell you, there's actually an interesting question on the census that says, so because of COVID, my 2 college-age students were actually home, and while I included them, it actually asked you another question, if these folks should be counted in another setting, if they, would normally be at college, or, if they live somewhere else for another reason. It asked the question if, a person that would normally be in the home, if they were in jail. Because of the group quarters, they want to really make sure that in getting that accurate count, that the census is able to kind of deduplicate some of the information, because there has been some confusion about where do you count this person or where do you count that person. And the number of conversations that we've had with the Census Bureau, they have a lot of data folks that help really sift through that data to understand where folks should be counted as well. So I really encourage people, fill the census out. Everybody in that household that is there, put their name, you give the name, you give their date of birth, so that we can really know who's in our community and we know how to serve those individuals really, really well, so that we get the dollars allocated to our community for everything from roads to, planning and development, and our elementary schools and our junior highs and high schools. When we look at the workforce, and the impacts of COVID on the workforce, we want to make sure that we're looking at long-term recovery from the impacts of this.
Exactly. And you bring up a really excellent point about how COVID has really rolled back what we don't know about where people are and the services that they need. And so this pandemic is going to completely upend how we approach a crisis in the future. I just want to say thank you so much, Ondrea. This has been invaluable. I know you're doing important work at NVFS, and thank you so much for being part of Counting Every Person here in Northern Virginia.
This is Radio Fairfax, original non-commercial programming by Fairfax County volunteers. Come join us and put on your own show. Learn how on the web at fcac.org/orientation.
Cada 10 años, el Censo de los Estados Unidos ayuda a determinar cuánto dinero recibe el condado de Fairfax del gobierno federal para brindar servicios como transporte, educación y vivienda. En marzo de este año recibirá una invitación para completar un cuestionario confidencial sobre quién vive en su hogar en el día del censo, que es el 1 de abril. Puede responder en línea, por teléfono o por correo. Por cada persona que no responda, el condado de Fairfax podría perder $12,000 en fondos federales para servicios públicos durante la próxima década. Imagínense si una familia de 4 no responde o 10 familias de 4. La ley federal mantiene las respuestas del censo seguras y confidenciales. Su nombre y dirección no se pueden compartir con la policía, agentes de inmigración o ninguna otra agencia gubernamental. En el condado de Fairfax queremos que todos cuenten, sin importar su edad o estado migratorio. Si vive aquí, queremos que lo cuenten. Visite fairfaxcounty.gov/topics/censo para obtener más información acerca del censo.
Welcome back to Making Change Radio. I'm your host, Catherine Reed, and tonight we're talking about the 2020 census. Joining me in this segment is Krupskaya Elliott, who is a community organizer for the Legal Aid Justice Center. Thank you so much for being with us, Krupskaya.
Thank you. Thank you for having me.
So, according to the Congressional Black Caucus Foundation, more than 1.7 million African Americans and 2.2 million Hispanic Americans are at risk of being undercounted in this census. The current COVID-19 pandemic exacerbates the potential for these undercounted populations in non-responsive rates. So, Black and Hispanic communities who may not have internal access, as well as other communities that lack the resources to accurately complete the census, comparable to other communities and populations, we need to really look at the undercounting in the communities of color that result in a lack of billions of dollars in federal programs like Head Start and Medicaid and SNAP. Can you shed a little bit of light on what we're doing for these particularly undercounted communities?
Sure. At Legal Aid Justice Center, we work very closely with the communities in Annandale, Full Church, and we also manage some food distributions that we have in these communities. So we have been bringing, before the census started, information about the census, the importance of filling out the census, and especially trying to combat the fear of sharing information, because in the immigrant community especially, that's the biggest fear, that their information, their status, immigration status, be shared here with the federal government. And so we are trying to educate the community about it and assure them that the information is not going to be shared. Also, something that I found interesting while doing this job, doing specific this working in this initiative, it was that I went one night to do a reach to a community in Full Church. It was a church that actually they do they serve meals, and a lot of the people that come are elderly people. There were a lot of Latinos, but there were also Filipinos there. And going back to what Caroline or Ondrea, I think they talk about how the 5 and under are undercount. What I encountered in that community was that they thought that older people didn't need to fill out the census, and I thought that was curious because, you don't need a school anymore. And so I was trying to tell them, well, but you actually need, like services like hospitals and stuff like that are also important. So that is some of the stuff that we're doing right now with the COVID-19. As I said, we work very closely with this community, so I have people's phone numbers. So from time to time, I've been sending text messages reminding them that it's important that they count themselves. One of the communities that we work very closely is actually one of the tracts in Fairfax County that is the harder to count. It's one of the lowest which Fairfax County receive return census forms filled out. So we're trying to work really hard in those communities. I have to say that before the COVID-19, the biggest fear was definitely sharing information. With COVID-19, I feel that the more than a fear is like less of a priority have become the census, because people is very scared of, not having enough money to pay rent or not having food. And so trying to, help in that front, but at the same time remind them that it's still time to fill out the census and work on that.
I think you're absolutely right. I think the COVID-19 and the pandemic, a lot of these underserved, undercounted populations are already struggling to survive every day. And this pandemic has added a layer of struggle where they truly have to figure out how to just survive from one day to the next. And so I'm sure the census is not top of mind for them. And yet the clock is ticking. I know that there's been some talk that they might extend this into August as far as, trying to get responses back from people because of the pandemic. But again, we'll remind people that this is a snapshot of where people are living on April 1st. So even if they were to delay collecting the census information, pushing that deadline out a couple of months, it still comes back to who was living at your address on April 1st. Why is that so important, for it to be a specific date? I think that if we will have like a moving target of the date, it will make the collection of the data even more difficult. It's very important that we tell the community, it's less complicated, less variable, just to say this day and we're going to count whoever lives this date and this household. The communities that I work with are very, very afraid. And as one of the guests mentioned before, there are multiple families living in the same household. And many times these families, they just come to live together as a matter of just because it happened that way and they knew that someone was renting a room, but many of them don't know each other. And so I think that another reason why people can be undercounted is because they don't know each other. If the census come and I am the person who is here when the form gets there, I'm going to count my 2 kids and my mom, but
What about the older family on the other room? And so that is also something that we are trying to inform the community about. Everybody should be counted, everybody at April 1st. And so it's definitely a challenging job, but we are hopeful that this time people is going to participate more.
Well, you bring up an interesting point about elderly people, and this was of interest to me when they first talked about these stimulus checks that were going to go out to everyone, and said that people who had not filed income tax return would not automatically get these checks. And there was this huge uproar because there's a lot of older people who get Social Security benefits who do not file a tax return anymore. And that was a revelation to me, like, oh, wow, right? So these elderly people don't file a tax return, and therefore they're not in line to get the stimulus check. The federal government did reverse themselves on that. They are going to get a stimulus check. But the fact of the matter is that when you reach a certain age and you are not filing, for instance, a federal tax return, you're not filing any tax returns, then I can understand an elderly person saying, so then why do I need to fill out the census? I can see them making that leap.
Yes, and actually something that I can talk more about, a similar link that recently happened. Immigrants that they do tax returns, but they do it with an EIN, not a Social Security number. They are doing tax returns, they are paying, and they are contributing to the community. However, they are not eligible for the package. And so one of our clients said to me, why should I care? Why should I care about paying taxes? Why should I care about doing the census if they don't even take me into account? And so it's as I said,
that's a real hurdle. I can see where that's a real hurdle. Like,
yes,
why play ball? Why participate if there's no tangible benefit to me that I can see?
Exactly. So it's a fine line, I have to say. And so on the one hand, I understand, this person being upset. Like, he is someone who pays taxes. Just happened to do it with a different number than mine, and so because of that, he's not eligible. And so it's a lot of dancing around, like try to explain the person, yeah, I see your point, but still you should do it because this and this and this, all these things that you are eligible or are just beneficial in general for the community that you live in. But absolutely, it's not. Sometimes I feel that some of these policies don't make our job easier.
No, I can see that. So for those of you who are just joining us, this is Making Change Radio. I'm your host, Catherine Reed, and tonight we're talking about the 2020 census, getting every person counted in Fairfax County in Northern Virginia across the Commonwealth of Virginia. Joining me in this segment is Krupskaya Elliott, who is a community organizer with the Legal Aid Justice Center. She is speaking of the difficulties of trying to convince people who live among us as to why the census is important for them to fill out, especially if they don't see themselves as beneficiaries of some of the programs that we're seeing now, especially around stimulus with the COVID virus. So, as far as language barriers, are you finding that people are in any way intimidated by calling the phone number or seeking help if they need help filling out the census? Is language a barrier in these communities?
I feel that it is and it's not. I feel that the people that is conscious of the benefits of filling out the census, they are going to fill it out, even though, English is not the first language. I feel that the hurdle is more of convincing the people about it. Once they are convinced of the importance of doing it, they are going to find a way to do it, even though English is not the first language. I have been sending to the community the link in Spanish to do it. I have to say I have some response and some not very positive responses about filling out the census. But once people is convinced, they know the importance about it and they are doing it. But as I said, more more tricky point is to get them there and to convince them that it's important and, why it's important. Maybe you don't see it's important for you, but think about your kid. They're going to go to high school here, and they're going to need, hospitals and services here. So that's kind of a way of where we trying to shine line of the importance of doing this.
Do you find that people get confused if there's any person who may have been is incarcerated, whether that's a confusing situation in the household? Are there grandparents taking care of grandchildren in an informal situation that might cause confusion?
It does, because many times they don't know, should I count it, or just assume that the parents are counting, or who is counting this person. I also have to say that something that is confusing, especially in the immigrant community, is the term resident. And I know people say, oh, well, it's different. But when you come from a different country and you keep hearing, the difference if you're a resident, you're not a resident. And so people get a little nervous about assuming they are a resident because for immigration purposes, it's something different. So that's also, I have to say a lot of these jobs requires cultural capabilities about this and to know what people might be thinking about, when you say, well, you are a resident here, and they right away say, no, I am here undocumented. And so that kind of situation to navigate such situations is tricky sometimes. But that's why it's important to have organizations on the ground doing this kind of job, informing the community, educating the community, and breaking those fears is very important.
And I never even thought about the term resident and how, it's a status.
Yeah.
It's a status as well as being a word in English that means you reside here. And that's just part of the English language being very confusing on many levels. And we probably need to come up with some different vocabulary going forward that helps people understand what we mean, that you're living here, not a legal status or a government status or a status of any kind. I can see where that would be an immigration status. I can see where that would be confusing. And that's maybe not obvious to the people who prepared sort of the language around the census to understand how it would be interpreted. But again, people have so many different living arrangements. You do have families that are living unrelated families. You have people living together who are just unrelated. You have grandparents taking care of grandchildren. You have a lot of single parents or parents who share custody. So a child might be in two residences, technically.
Yeah, it's interesting because unfortunately a lot of the people that we serve are single mothers. So they have I don't know if it will, sometimes they say that within white communities, American people, children of divorced parents are actually counted twice, and with separate couples, actually, especially children of immigrants, the kids are not counted at all. And so that's the problem we have, which we run into that issue, I think, that Ondrea mentioned before, that kids under 5 do not get counted. For some reason, Latinos, we think that, under 5 should not be counted, and that kind of thing. Instead of being count twice, it's actually no count at all. And so that's also another aspect that we need to enforce in the community, that everybody, especially the kids under 5, should be counted.
Well, and again, I'm glad that we're raising these issues tonight because they're not necessarily things that a lot of people have given thought to. And we need to help our people in our faith communities, people in our neighborhoods, people in our workplaces, people that we know who may have decided it's too confusing. We need to help people understand that it matters. It's critical to the health of their families. It's critical to the health of our communities that we count every person and that we have the resources and the federal dollars and the programs necessary to make sure everybody thrives in our communities. I want to thank you very much, Krupskaya, and thank Ondrea and Caroline, too. The three of you have done a great job tonight in helping to really shine a light on some of the hurdles and challenges that we face in trying to count everybody in the Commonwealth of Virginia. And for everybody listening, this is Making Change Radio, and you can hear us every Thursday night at 9 p.m.